Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies? If yes, the School of Interdisciplinary and Transdisciplinary Studies offers various programs like Master's Program, Graduate Program, Postgraduate Diploma, Certificate and Appreciation Program. The school offers 5 Master's Program: Master of Science, Environmental Science. The eligibility criteria for MSc Environmental Science is Graduate in Science, BTech, BE, Agriculture Graduate, Forestry Graduate and Veterinary Graduate. School also offers Masters in Environment and Occupational Health, Masters in Sustainability Science, Masters in Philosophy and Masters in Folklore and Culture Studies. The
Namaskar. Welcome in this live interactive teleconference of MBA in Healthcare and Hospital Management program. Dear students, as you know that we have a project under this program which need to be done under this 3rd semester. This is very important. Currently lots of students are in the 3rd semester, and students who are currently in the 2nd semesters, they will also to be 3rd semester in next semesters. So today we are going to discuss about the research methodology in reference to the project. And to discuss all these things, we have a very experienced professor, Professor Jugal Kishore. Welcome you, sir. Professor Jugal Kishore is the professor, former head of the department from Safdarjung Hospital and VMMC Medical College. And sir has a very vast experience, particularly in the field of the research methodology. And today, sir will discuss about this research methodology in context to the project for the students. So if you have any queries, you can ask. The display numbers are display on our screen. And sir, you can start the sessions.
Okay, thank you very much, Dr. Biplab. This is very interesting topic for all the medical students or anybody whoever is working in health discipline. When they go in a post-graduation level, even today undergraduate level also, we are teaching the methods in scientific methods are taught. But post-graduation, they have to be master of doing the research. Then only they appreciate the scientific findings of other research going on in the world and also in India, and using those scientific methods for improvement of their own working at whatever level they are working. So we'll discuss, because the topic is very vast, we'll go very fast, try to cover as much as possible, but focus would be that how you have to gear yourself to make the synopsis, and then how you will go about the project work. So with this, the question in front of you comes like, what are the common diseases treated in our hospital? You will be looking after the hospital or maybe community as a manager or as a health professional, or a community health physician, or maybe looking after the administration or management side. So a question comes that what kind of problems are there in my community or in hospital. Next is, why do these patients come to our hospital? And next question could be, how efficient system we have to handle incoming patients. So if they're coming to us, then how better we are able to manage. So what are the efficiency of our handling this? And what are the causes in any kind of delay, if it is there, if they are coming to our OPDs or indoor. So if there is any delay, then why it is so. And why do I select the appropriate diagnostic test? Or say, the doctors will come to you saying that, this is the new diagnostic test, should we use it or procure it? So you have to make a decision that should we purchase this kind of equipment or not. Or, new diagnostic information, or maybe, some kind of a algorithm is set. So how we have to use it. Then, there are different types of treatment, and the people will come that the higher cost of the treatment is much better than the low cost. So as a manager, one has to, find out whether this low cost medicine can also be good and very efficient, and we can save money. So such kind of decisions at the hospital or a community level are very crucial. Or maybe under certain situation, what would be the outcome or maybe prognosis of my patient if they are treated in certain way or maybe regimen, then what would be the prognosis. Then what are the cost effective management techniques available in our settings. And then are our patients, family or community satisfied with our services. That's a very important and crucial finding out the quality of the services which we are giving. So if you see that all management aspect has been dealt with, which is can be taken as a project, or maybe I think you can understand by research methods.
But these are the only a few area of the entire gamut. There may be many very specific issues at your own hospitals or at your own community, and that questions has to be generated by you so that you can finding. Sir has just given a couple of examples, but don't think that this is the everything. There can be much more the research questions which may you encounter in your
when we'll discuss about the project, the certain more areas will be covered, and you can see that there are many more, and rightly said that it may be institution specific, the area specific issues may be there. So first question is, what is epidemiology? And when we say what are the essential component of epidemiology, so remember, when we are dealing with the health or disease, then the question comes, how much health issues are distributed, how much disease distributed in a particular area. So that's a distribution of problem. Next would be how frequent they are. So any kind of decision or allocation of resources based on how frequent the problem is, how they are distributed in a community, or maybe in hospital, what kind of problem coming. So distribution of the different types of the patient coming to hospital. So what kind of resources are required? So that kind of information is required for you. Then what are the reason for such kind of problem? So that is the health related events or disease. That you can say determinants. So determinant could be various kind. Can be physical, biological, social, and social determinants are becoming more important nowadays, and you must be knowing that, SDG goals are focusing on social determinants. And understanding of all this, application of this knowledge in prevention and control of the disease. That's the ultimate aim of the epidemiology. Now you see this one is a very interesting one, that health is actually affected by, community, society, individual and family. So these are to be understood. And when we are trying to find out the cause, maybe I think you cannot leave the society or community to understand the health issues. And then you see that, there are a number of other factors which are affecting our community, family or society or individual. And then it is affecting our own individual health or a community health. So that could be biological, maybe some biological event has come up, like the COVID has come. So it's a biological, determinants. Another one is a behavioral, what kind of lifestyle we are adopting, leading to so many other type of diseases. So that's a non-communicable diseases. Similarly, the environment, like the air pollution, water pollution, these all things are important. So you see that health system itself can be a problem. If we don't have a good health system, or we are not able to provide certain kind of, health delivery properly, then can be leading to a problem. Then we have a socio-economic factors, the poor, urban areas. We have a cultural factors, like, kind of culture we are dealing with or living with, causing a lot of issues. Then we have a aging problem, like, more the aging problem or aging of the population, the demographic changes. So we have a certain type of disease. If we have a younger population, we have other disease, and older population have a different disease. Then how much science and technology is developed or available in our settings, or maybe in our country. So that is also going to affect our level of standard of living or standard of our health. Then we have information technology, gender issues are there, health equity, how much we are concerned about the equity, social justice. They are all important in human right. So you can see that large number of various factors available which are affecting, to our individual health. And that is why when we are, after finding out, we might be having that the biological issues are not important, but maybe gender issues are there, or maybe socioeconomic issues are there. Like in case of hospital, if patients are coming and we are not dealing with their gender, they will not come. Like most of studies showing that this gender, the third gender or LGBT patients are not coming to general hospitals. So because the doctors are not responding well. So you have to sensitize your, hospital in such a way that everybody comes and can get the, treatment. So these are determinants. And any problem arise, you have to see that you can do some kind of research, find out the issues or problem, and then solution. You can also find out what kind of solution is better than other. So this is all about health research. So health research is a systematic collection, description, analysis, interpretation of data that can be used for improvement of the health status to prevent and control of disease in individual and group. So that is all health research. So aim of the research is to discover the new fact or interpretation of whatever fact is there. We have a knowledge, like for example, we can see that everybody was knowing that the apple is falling on the ground, but it is only the Newton who has thought of why the apple has gone into. So whatever information is there, you just ponder upon and try to find out the reason. Then the revision of the theories. We have a relativity theory. So the Newton theory will continue till the relative theory by the Einstein has come. So, discovery of the new things or revision of the old theories are the basic, research. Then laws in the light of a new, facts. So if you understand the whole issues, then you try to find out that this is the main issue. Like in case of equity. Equity is a, term which I think everybody understand now that, it is a major issue in developed nations where, certain group of people, a certain class of people require special attention as compared to other. So that understanding is very crucial for the managers, crucial for the administrator. Otherwise, you will never understand. You will continue to say, no, though everybody should get the equal opportunity. This equal is different from equity. So that's what new laws are, created by new facts, if you understand that. And practical application of new theories and new laws. So these are all research, questions. So when you're making a question, better is to, follow certain acronym. And that's the FINER. Suppose FINER means feasible. Feasible, like technical expertise, number of subjects, manageable in scope and affordable. That's a feasible. Like, time and money is there. So when you are conducting a research in your institution, see that you have a time and the minimum time is given to you. It is not that unlimited time is there. You will continue to do research for 5 years. A certain time is given, so you have to finish. So your research question be such that you can find the answer in 1.5 year or 1 year, whatever time is given to you. Then it is technically sound, like you are able to conduct it. It should not be that if you are not able to conduct, you can be trained in it, and the training should be available around. So that is what the feasibility is. Then it should be interesting. It is not that you just pondering about something which is already known, and you say that stress is causing heart problem. We know that stress is causing heart problem. But the issue is that what kind of stress and level of stress and how we have to decrease then, and what methods are available. They are interesting one rather than, just things which are already known may not be interesting. So, and then novelty is there. Confirm the existing finding or extend existing finding or provide new findings or to add something to the scientific knowledge. So that's what the novelty is, that it should be interesting, it should be new, it should be different. So that's make a thing. At the same time, it should be ethical. It is not that you do some kind of experiment or do some intervention and it is harming the patient, harming the group. It should not be, taken as, guinea pig. So the no patient or a no community member should be taken as for granted. It should be taken with justice, with, autonomy, with, freedom, with, all kinds of possibility that this person can withdraw and he is willing to be part of the research. Then only we can say it's ethical. So ethical, the research question should be such that it's ethical. And last one is a relevant. Whatever finding is there, it is not just interesting and novelty, but should have some relevancy of, to the population or to the public or to individual. It should solve the problem. Then only it makes some sense. Otherwise, just having a new things, it doesn't matter. So
I think here's the most important point what all the students need to emphasize is the ethical component, because whenever you do any research, particularly related to the health sector, where the information of the patient or individual is involved, you should take a consent, and most appropriately it is written consent. And one more thing is like ethical committee approval is very essential in some of the studies, and students can obtain the same from the nearest medical college, because every medical college has a ethical committee. So you can apply there, and these days I think almost every district is having a medical college, so they don't have to travel so far. So you can apply, and they will give you, and they maybe give you good guidance also when you apply for the ethical clearance. So these are the few facts which you need to follow very seriously. Otherwise, you should not land up in some kind of trouble, and in that case, IGNOU will be not responsible for what you are conducting that is unethically.
True. So this is a simple acronym, FINER. If you apply the FINER, you can design your question. We'll discuss one by one that how further you have to go about. So the type of questions, again, you can focus on that. It can be existential, like, for example, do hospital require management? It is something very essential, obviously it is the existence of the management program. And if you say, yes, it is required, what kind? Then next question comes. Description and classification of particular disease, or maybe I think characteristic of leadership. These are important. So these are again further questions which you can try to find in your research. Another one is a composition, like what are the component of the health system and what are the stages of burnout among staff leading to resignation. They are the composition problem. And then relationship, like is there any association between high case fatality rate, any staff vacancy or experience. So that is a relationship, research question. Descriptive can be comparative, like are women are more aggressive than the men? Are women staff nurse more, empathetic than men? These are the important questions, to know, so you can start training of these people, of the empathy. Causality is like, is it causing this? Like, for example, does stress X causes lead to or prevent anti-stress strategy? You can choose anyone. Changes. Does biomedical waste management training leads to lesser infection rate in ward? Or does dirty water cause disease? Or does clean water prevent diseases? These are, causality issues. So you can frame such kind of question for research. Causality comparative, like, effect of X are compared with the rival treatment Y or Z, you can say. So two type of strategy, two type of treatment modality, or absence of a particular type of strategy or treatment can lead to, better outcome. So these are the causality comparative study, which you will find more in experimental study. We'll learn more about it. And comparative interactive, like, if you join with two strategy, the effect is more or less. So something like, does training improve the performance of technician, then increase salary, or does not under decrease salary? So if you increase the salary or decrease the salary at the same time, train them. So what kind of effect would be there? So it's an interactive type of comparison. So origin of research question should start with day-to-day work. So if you are already working in hospital, you must have seen the problems. So these questions should be coming in your mind, and try to find out, what are the causes and how we can handle that. That can be a very interesting one. Something that makes you wonder, bring forth emotions of joy or frustration or anger, when you are working in any institution, or argument with your peers, leading to a research question. Another one be a published literature. We are expecting our, postgraduate student and MBA student are keep reading journals, newspaper, all these things. And through that you get the information, or maybe a new ideas that it should be experimented, should do research in my environment. I think it would be very nice. Similarly, you can talk to your supervisor. When you talk to them, they will give you guidance, and then, on their suggestion, you can frame your research question and can make the project. And last one is, then you are meeting with the scientific meets, conferences, workshop. There you get the information. There you can get the ideas for the research. So these are the different, sources by which you can get the, idea for the research. Another one is, prevailing belief are there, practices are there. Should we practice in similar way or change them? Skeptical attitude is very important. If you just accept whatever is going on in the community, you are not going to have any research question. You should always ask question, So a person of postgraduate level, rather all type of people should have the scientific inquiry. A skeptical mind should be there in our all individual, of India, where they should ask question and find out the solution. Then only you can be a researcher, good researcher. And application of new technology, like whatever is now coming, you must be seeing that AI is coming, artificial intelligence. So many research ideas are coming. We are exploring how the artificial intelligence can be, used in our medicine, treatment, hospital management, all. So they can be a new area of research. And another one is, few examples are there if you wish to read them, like the depression resident doctor, what are the reasons, varicose vein in nurses, study of risk factor of a specific disease condition like TB in hospital staff, because they are always working, and always question is there whether they are more prone to or not. Skin dermatitis, hospital operation administration, like focus could be on hospital healthcare quality, patient satisfaction, or patient safety, or health information system is created. So how we can further improve, or can we add something else, or digital health, can give idea of a new research area, or health economics can be another one, where you can find out the cost effective, cost benefit, analysis can be done for different treatment modality. Then finance can be another area of your research. Then human resource management, like healthcare, we have various kind of healthcare staff is there, and seeing how we can improve their performance can also be what kind of policies are required, in what area the policies are there, which policies are there and which can be added, or maybe I think criticizing the policies. So there are many topics can be there which can be selected for your research.
Yeah, maybe policy, maybe hospital specific also.
Yes.
Maybe it is state related also, or
And
maybe
national
country national level also. So
Yeah.
you can choose the policy also.
Yeah. So objective, when you are framing the objective research question, after that you will make the objective. And it's again, I'll use the word the SMART. SMART is SMART, like specific, measurable, achievable, relevant, and time. So similar to research question, it has to be again, something which can be measured. The objective should not be unmeasurable, irrelevant, not achievable. You can see that my hospital should have highest quality of care. Now, what is that highest quality? One has to specify, So objective should not be to achieve the highest quality of care in my hospital. So highest has to be measurable. It has to be achievable. It should be time bound. So objective has to be made in such a way which should specify these all things.
Yeah, we can
Then
define
only-
the highest, maybe like 80% of the patient
Yes.
should be satisfied. Then as per my definition of the highest, it is this.
within 1 year,
Within
or
maybe
within
1
2
year
years,
or 6
within
years,
5
6
years.
months. So they can measure whatever term they are giving.
Yeah.
Operation definitions can be fixed.
Yes. Then next is, okay, once you identify the research question and make the objective, then through what and by what method you are going to achieve those objectives. So there the material methods come, for which you require material methods. So what kind of research design you will choose? Target population, in which kind of population you are going to, the patient, staff, general public, these are all kind of patient. Then what kind of sample size, how much sample is sufficient to be handled, and how you are going to select them, method, sampling methods. Then inclusion criteria, the sample or the participant you are going to include, what are the criteria of inclusion, and whom you are excluding, that you will not take. Then how much time is there, the study period. Then what kind of variable, like in individual, what you are going to measure. You are going to measure knowledge, attitude, or practice, or you are going to measure their blood profile, like blood sugar level or hemoglobin level, or they are all variable, which you'll learn, there are different type of variable we'll learn. But these are the important thing. Till you do not know what are the variable I'm going to study and what would be the outcome, it is difficult for you. Then you have to define all the variable, as Dr. Biplab have said. We have to be very clear what kind of terms you are using in your research. It can be operational also. Like in my study, I've used this kind of definition. It's fine, but you are clear that what you are going to do. So whatever way you are going to achieve should be clear to you and written.
Yeah, but in this case, sir, student need to know that there are many standard definitions available scientifically everywhere. For example, if you say like hypertension, then a person having blood pressure equal or more than systolic 140 and equal or more than 90 diastolic is the count as a hypertension.
Yeah, it's a variable. Or it's a,
Yeah, it is a variable. The same way like old age, if you say old age means they are supposed to be more than 60 years of age. So you cannot operationally define that more than 50 years is old person, because you should not deviate from the main standard acceptable variables.
Or
What
in
is-
India or worldwide.
Yeah, across the scientific community that accept that part. Like diabetes mellitus, if you define somebody, their fasting blood sugar has to be more than 126 mg per deciliter. So these are the few standard definitions when you do operational definitions, or you define some variable, you have to make consideration of those points. If it is not available, then only you are allowed to do this kind of scientific operational definitions. But for that also you need to do literature review to find out in what are the different studies where they have defined these kind of things. I think that will give you much better.
And in that I just want to add, when you are using such kind of definition of the diagnosis, whether it's a hypertension or diabetes or whatever, there are standard definition, but they are standardized by which agency, where they have been, accepted, and worldwide that definition has been used. Like, Jones criteria is there, or maybe WHO criteria are there, or maybe Indian criteria. Like for the BMI, we have the South Asian country, WHO criteria are used, or ICMR criteria. So if you use, then nobody is going to ask question. They are the standard one and also specifying. Because, this kind of division, like, old age, we say 60, but in other countries 65. So one has to say that 60 according to Indian standard, according to Western standard, then, so according to some standard, you have to define, and maybe I think give the reference also.
Yeah.
So that is where the reference value also come. Next step is the methods of data collection and how you are going to collect the data. So I'll describe each one one by one. Method of analysis, including computer package and statistical method. So when we say study design, so what are the different type of design? Whatever study design you are going to use, see that this is appropriate and feasible. Again, the feasibility come again and again. You are as a student, see that time is available, I'm able to conduct, money is there, not, extra money. You can't spend money from your own pocket all the time and maybe a big amount of money. So one has to see that it is manageable. You can see that this much is okay. If suppose you want to buy something or want to get the printing of questionnaire, so you can say, okay, I'll do it. 200 copies, not a problem. But if suppose, it's costing a huge amount for investigation, maybe I think you have to, join hand with your institution. That is why the ethical issues come. That is why the ethical clearance from institution come, that they are going to help you in these all issues. So whether it's applicable. So these are all feasibility. Then only you have to, decide what kind of study design is there. Remember, we have the major two division. One is a explorative type of, study. Other is a conclusive type of study, research. So exploratory is usually not done in our medical field. We are more conclusive in nature. It has to be concluded or conclusive. Then they are taken as, because we are dealing with human being. On other side, when it's a exploratory, historical, or maybe some forest, or maybe some, monumental studies are there where exploratory in nature are there. But those methods are now slowly coming to our medical science also, because we have so many social issues. So qualitative studies are accepted as one of the, method by which we can, substantiate our finding. So that is why I'm telling you that two types, and both can be used. And if we are using both the method together, then it's become a mixed type of study or hybrid type of studies. So that's upon you that whether you want to use both or just single one. Conclusive can be descriptive or analytical or experimental. Many a time it is only one type, descriptive in nature, and in like management, usually they do descriptive in nature. Analytical is also very less, but experimental usually not done much. But in hospital setting where you are trying to have two different methods or treatment or something, or you want to assess the effect of the training, then the experiment comes. Then in broadly we can say, when we say the descriptive or analytical, they are observational. Actually, we just observe. We don't do any kind of intervention. So further we can divide into two. That's a observational and intervention. Observational or experimental, we can say. Observational are either we do it in a population or individual. When we do it in a population, we can do survey, go to and do the survey. Or we can have the ecological study, like where the many villages or communities are taken as a sample. So individual groups or hamlet are studied, then it become ecological, where the focus is more on covering the larger population and not comparing with each other. That's a two type. Usually that's done by public health people. On other side, usually in a individual hospital or a small number or maybe individual, then it is descriptive or analytical. Descriptive can be case report or case series. Actually, case report and case series are very simple one. Clinicians are doing a lot of such kind of case reports. In your case also, you are not allowed to have just case study or case series. Case study, like one single case, describe in detail everything. That description itself gives rise to understanding of the problem. That is why it's a descriptive study. So remember, we are not, allowing, or maybe you can say we don't give case study because it's a very single case or two case or three case. They are not good enough. It's better to have, larger number, called analytical type of study, where it can be cross-sectional, can be case control study and a cohort study. So three types are there. Means the cross-sectional means at one point of time, you just see everybody, every person is analyzed. One point of time means like you will go to one each individual at one point and collect the data and do the analysis part, and then you can have combination, permutation, combination. All these things can be done to find out the cause and find out the relationship. And similarly, in case control, we have the cases with the problem, like cancer are there or TB is there, and you think that cancer because of, maybe you can hypothesize the cancer because of exposure to some chemical or exposure to smoking, exposure to radiation. And you want to find out whether the exposure of radiation leading to cancer or not. So what you'll do, you have the cases and you will find out the history among them. Then suppose you find large number of patients are having the history, how you can establish? Establish is only possible when you have the normal, control. Control means that those who do not have the cancer, and also see that among them the history. So then only you can find out, okay, in those who do not have cancer, actually the history of exposure is less. And in case of the cases like the cancer, the history of exposure is more. So you can compare the two risks. So that where you can calculate the odds ratio. So case control study are very common and they are very good. And rather the establishment of cause and effect between cancer, lung cancer and smoking is established by the case control study. On other side, we have the cohort study, where you have group of people or having similar characteristic like same age or same gender, or maybe they are recruited in one time. So they are followed for years, like 1 year, 2 years, 3 years, or maybe more. So you follow them and see that how they develop the disease. So exposure and disease are studied in front of you. So you are more confident, you are observing them. So you can establish causal association in them. So cohort study is very good, but problem is you have to follow for many years. You have to be there. Sometimes you leave the job and somebody else will come, will not be followed properly. On other side, case control are good, but the problem is that they will be, recalling over a period of time that what kind of exposure is occurred. And many times you forget. So that is a recall bias can arise. So biases are common in case control as compared to the cohort study. So cohort study is much better because you are observing them, following them, you yourself are analyzing the data. So that's a good thing in case of the case control
Yeah.
study.
I think they need to means very categorically understand this fact that every study design has its own advantage and disadvantage. So depending upon your situations, you are the best judge to explore what kind of advantage you can afford and what are the disadvantage that you cannot afford. Like although ideally causal relationship effect cohort is the very good study, but in different circumstances it is not feasible. Sir has always talked about the feasibility of the study. So the cohort may not be feasible. In the same time, the case control, readily hospital records are available widely, so you are already working there as a means medical record unit maybe, so you can means explore that record and you can easily conduct the case control study. I think you have to be very particularly should know that your strength and weakness of your own situations and better explore the your best project which can be mean scientifically sound and giving us a new scientific knowledge to the community.
Next is experimental, which again you can do, although they are supposed to be robust. But how you can do? We can have like the training. So you have a group of nurses or doctors. You train them. So you will do the analysis before. So pre and post analysis can be done. The pre, what was the knowledge, and after training, maybe after immediately 1 month, 3 months, something like that, you can assess their knowledge. So whether the knowledge improved or not. So this become a single group which is given some intervention and seeing the effect. So this is known as we have not randomized, and it's a kind of a quasi experiment. So they are known as a quasi experiment study. So they are very feasible, and I think you can adopt. On other side, we have the randomized controlled trial or randomized trials or studies where you are selecting the people by randomly, and randomly like not haphazardly, but we have a scientific methods by which you get the participant in an intervention and non-intervention group. So you can see that how you are going to select in intervention in non-intervention. So both have the equal chance of being selected in intervention, non-intervention. That become equal opportunity, equal probability. Then it becomes randomization. So there we have a randomized trials, a randomized control trial, like where we have a control, then we say the randomized control trial. If we do not have, then randomized trial only without any control, or comparative group. So depend on how you are going to conduct that research, you can label it and do it. And there are support system. I think it is just to introduce you, although we have various method of selecting things, conducting the research. So broadly you can say that we have the non-randomized, randomized, quasi-experiment, and more. Same can be done in a hospital or in one ward or maybe in community. Okay. So another term is prospective and retrospective. Prospective means like forward going. It can be just 1 week forwardly, like you have the cohort study, they are all prospective in nature. And direction is known. Similarly, retrospective, like direction is going back. So, retrospective. So in case control, we are trying to find the cause over a period of time. So we'll go back in time and trying to find by the recall methods. That's a retrospective. Prospective means you are going forward in cohort study and trying to find the cause and effect also. Or at the same time can be just so natural history of disease, or if the enrollment is subsequent, then it's all prospective in nature. Now clinical trial, like I've told you, can be randomized and non-randomized. Similarly, on a particular issue like the prophylactic, if you are using vaccination or a contraceptive, they are all prophylactic in nature, or they are used as a health promotion or prevention. So that is why they are known as prophylactic. Therapeutic trial means like we are using the drugs and using treatment or surgical procedure. Or safety trial, like just your focus on the safety of some drugs, then it's become a safety trial. Or focus on effectiveness, then it become an effectiveness trial. Like the, how one particular contraceptive is better than other. So how they are effective in controlling the birth, and the risk factor trials or efficiency trial. For example, your trial can be efficiency, like you are comparing the A&M and a doctor, whether both are able to insert the IUD, intrauterine device, because how much in the same time, or maybe who is taking the more time. But remember, the A&M, we are spending less money as compared to doctors. So if they are able to do the same work, then we'll say who is more efficient. I think the A&M is more efficient because she's able to do the same. So why we are asking the doctor to conduct this? So we can spare the doctor for some other. So similarly, you can have the efficiency trial in your institution to find out which one can be done by the more efficiently in the setting. These are the hierarchy of the establishing of the scientific evidence. It can be, although expert opinion started when I told you that you go to supervisor, try to find out the research question. That is a very good idea of finding which are the areas and what could be the cause. They over a period of time they know things, so their expert opinion play a role.
The screen larger, sir. No, sir. That I think cursor need to put to make a full screen. Yeah.
And after that, we have the animal study to establish any causal association, or maybe and then we have ecological study, case control study, or prospective cohort study. Then controlled trials are there. Then randomized controlled trials are there. Randomized controlled trial got the Nobel Prize also for their robustness and a new technique which can establish causal association. So you can see that randomized control are rank as the highest. Now after that we have got another which is known as systematic reviews or systematic meta-analysis. Meta-analysis can be done for randomized control trial, case control study, cohort study, or descriptive studies. Meta-analysis like combining the result of various studies done in the world or maybe in India. You can focus according to your need and then analyzing them again. And just you are analyzing and giving the different type of study, that's a systematic review. But when you are using their number and then doing the analysis, statistical packages are there where you recalculate the risk or recalculate the prevalence rate, then it become a meta-analysis. It's very robust because they are representing the various areas. Various study keep happening. Some study happen in Delhi, other is Chennai, maybe in Kerala. So these study can be combined together and can find out what are the average of all, and that can represent the whole India. So that's what the meta-analysis are.
Yeah.
So they are supposed to be
highest.
highest.
They need to know about the meta-analysis because in various scientific community, maybe giving opinion just based on the one or two study basis. But overall, when you see across the India or across the globe, across the world, when the same kind of studies are observing, maybe only 10% of the studies are showing these kind of medicines or treatments are effective. Rest 90% of the studies may be proving that this kind of medicines or treatment is not effective. So they need to go as per the decision of the overall effect of the, maybe in particular group, maybe in India something may be effective, but it may not be effective in other geographical areas. So I think students need to be very well oriented about this meta-analysis also.
Yes, true. So that is why it has been kept in the highest in establishing the causal association. So these are the ranks, and you can see that. So I already told you that meta-analysis can be descriptive, analytical, or maybe experimental. Now next is the inclusion-exclusion criteria or biases and confounders. So inclusion criteria, like you are going to conduct research in adult population. So you define 18 to 60 years, 18 to 45. The people who are younger than that, you are excluding. Or above 45, you are excluding. Or maybe above 60, you are excluding. Or you want to focus only on female, then the male is excluded. So these things are very clearly, described. Then we have the study period. I already said variables. You can see that variable and definition of all. Variable can be quantitative and qualitative. Qualitative variables like nominal, ordinal, nominal like the gender, male, female, blood group A, B, C, A, B, O, and AB positive. So these are the blood group. They are distinct, nominal in nature. The name has a characteristic. So similarly, they cannot be quantified. They can be enumerated. Similarly, ordinal is like mild, moderate, severe. Such kind of classification variables are actually known as a qualitative in nature. Quantitative is like total number of TLC, DLC, or maybe you can say age is number. So that can be time bound. It can be 14 years, 5 months, or height is also. So wherever you require measurement, that become a continuous or maybe quantitative variable. So you have to define which kind of variable you are using, and accordingly, you are going to have the statistical methods. So data collection, just few words about data collection. We have to use the instrument or tool to measure. It's a very crucial. If your data is not collected properly, according to valid standard tool or method, your whole research can be flop, because your analysis interpretation is based on the data. If data collection method is vague, then you are not able to, make any sense. So tool, can be cognitive tool like the knowledge part. That's a cognitive. Affective is like emotions. How you are going to measure the emotions. It cannot be like I'm feeling nice. So what does it mean? How you are going to measure it. So one has to have some method like the Likert scale is there. You are having very happy, happy, not very happy, sad, very sad. So you can, further divide your emotion effect. That's an effective instrument. Projective instruments are like, in that situation, what you'll do. So that comes your thought, your personality. These are all, instruments. So questionnaire, checklist, you can use the questionnaire, like number of questions are there in questionnaire, and checklist like, when you are going to observe, you see that this person is observed. So on how he is taking blood pressure, how he is taking, sugar, whether he has talk or not, these all are actually checklist. And the interview schedule is like you have some schedule and you just talking to patient, then you get the information. You can record it, or maybe you record, by verbally. So that's a interview schedule. So all three broadly, they say the questionnaire, but actually there are different terms, and in scientific terms you should use when you are actually in your project. Say what kind of. So few example like, you can have such kind of tool where, make such kind of right side you have a coding, and left side we have different types of questions. Similarly, these are questions are there, and if questions has to be asked in local language like in Tamil or Hindi, so English questionnaire has to be translated in Hindi, then only it is possible. Otherwise, patient will not understand what English is, or you may be going with the English version and you don't. We don't know you have used interpretation of what kind. So you get the right information or not, or the patient has understood what you have asked. So you have to speak the language which the patient knows. Then you can get the information. Okay. Then you have next is approval from the ethics committee, which we have discussed that each institution have an ethics committee and it has to be done through that. So remember, fabrication is not allowed. Plagiarism is not allowed. You will not just have the copy paste things. We have the software. If it is caught, then I think it will be rejected, your proposal. So you have to first check your thesis whole. It should be less than 10 percent. If it is more than 10 or 15%, I think IGNOU will not accept your research project. Ethics is very important, which we have already discussed. There are so many principles on which the ethics principles are formed. You have to ask the informed consent. There are method by which you have to see the informed consent. I have given the example also, like these are all synopsis. You go to the project, I think sir will tell you that, we have a separate module. You have to read all that will going to tell you how you will prepare the synopsis and what methods, different type of methods. This is the example of the, informed consent. You'll write everything and then get the signature of the patients and relative also. Patient has to be informed before getting the consent. So all information to be given, about the research. And it should be in the language where he is understanding. It is not given in, some other language. So these things are ethically very important and to be done. And I think structure and these all things, I think if you cover, it's much better.
Due to the shortage of time, we cannot discuss further. But here I would like to say sincere thanks to Professor Jugal Kishore sir. And one more important thing I would like to endorse here is when you use any instrument, that instrument has to be valid. And it is always better if it is qualitative in nature, it is always better which is already pre-tested and validated by the different scientific community. And for that you need to do a little bit of literature review. But when you are doing some kind of quantitative variable, then maybe a specific instrument, for example, height measurement or weight measurement or hemoglobin measurement, that you need to talk about it. And if it is not validated ever, then you need to do a pre-testing of the instrument. That can be a very much useful, and we call it pilot study, so that you validated that these questions what I am asking is carrying the same meaning or it is bringing the same kind of result. And today we learned lots about the project related research methodology, and there is no last date for synopsis submissions, as many students are keep asking, and there is also no word limit, any such kind of things. You are also struggling to find a guide, so my request will be, it is better you go and try to find a medical college, particularly hospital administrations or in a community medicine department or in many other department also. They may able to guide you in your research, and almost all faculty in the medical college are eligible as per our guideline. So these are the few things, and we have received a few synopsis in our Google form submissions. We are in the process of examining that, and very soon we'll give feedback about it. And at the end, I would like to say thanks again to Dr. Jugal Kishore and our team of the EMPC who is helping us to broadcast this program, and our all students who are viewing us. And thank you once again, everyone. Thank you very much.
Thank you.
Namaskar.
Namaskar.